Hello everyone, welcome to Easy Revision. Today let us read recent and high yield updated LMRPs of dermatology. Dermatomal vesicle distribution seen in herpes zoster, erythema multiforme, anti-malarial drugs, alopecia areata associated with pitting of nails, antifungal developed resistance in last 2 years and not routinely prescribed for tinea cruris and corporisis terbinafine. Rash and hyperpigmentations over nose after taking NSAIDs for 1 week due to history of joint pain and fever. The most likely diagnosis is chikungunya. Incubation period for LGV is 3 to 30 days. Nerve used for biopsy from lower limb is sural nerve. Misner corpuscles present in papillary dermis. Patient present with the rashes in groin region. The most important cause is 3 anamorphic asexual or imperfect genera causes dermatophytosis are trichophyton, microsporum and epidermophyton. A 16-year-old boy comes with oily skin and multiple nodulocystic lesions since 2 years. Best management is oral isotretinoin. Early lesions of Pemphigus vulgaris show suprabasal epidermal acantholysis, clefting, and blister formation. The floor of the blister may be lined with intact keratinocytes, the tombstone pattern. More than 30% body surface are blisters. Involvement of skin occurs due to drugs. Becker nevus. A Becker nevus in American spelling is a late onset epidermal nevus or birthmark occurring mostly in males. It is also known as Becker melanosis. It is due to an overgrowth of the epidermis, upper layers of the skin, pigment cells, melanocytes, and hair follicles. Cutis marmorata occurs due to exposure to cold temperatures. A child has a rash. His family history is positive for asthma. The most probable diagnosis is allergic contact dermatitis. Painless lesion seen in human papilloma virus. Child scratch his hand with pen. Red wheal appears and persists for 30 minutes is dermographism. Nerve taken for biopsy to diagnose neuritic leprosy is radial cutaneous nerve. Component of cement causing allergic contact dermatitis is chromium. Pruritus over fingers occur in scabies. Highest concentration of desmosomes seen in suprabasal portion. Positive hair perforation is used to differentiate common isolates that is Tinea mentagrophytes from Tinea rubrum. Tinea capitis causes hair loss with broken hairs at the surface, also known as black dot alopecia, as distinct from alopecia areata. Tinea manum typically just affects one hand and is concurrent with tinea pedis. Acute paronychia is painful, purulent, and most frequently caused by staphylococci. Chronic paronychia, soft tissue infection around a fingernail that begins as cellulitis but progresses to a definite abscess, is usually caused by a fungal infection. The main factor associated with the development of acute paronychia is direct or indirect trauma to the cuticle or nail fold. Paronychia patients with exposure to oral flora via finger sucking or hangnail biting should be treated against anaerobes with a broad spectrum oral antibiotic. Example amoxicillin, clavulanate, clindamycin because of possible Staph aureus and bacteroids resistance to penicillin and ampicillin. Type 1 leprosy reaction results from the activation of cell immunity expressed clinically by exacerbation of skin and nerve trunk inflammation, leading to sensory and motor alterations. Type 2 leprosy reactions are acute inflammatory reactions with systemic involvement, entailing the activation of pro inflammatory cytokines such as TNF, IL-1, IL-6, and IL-8. Patient with a history of multiple sex partners and a single painless clean cut ulcer with indurated base and rubbery non-tender inguinal adenopathy on the ipsilateral side points to a diagnosis of primary syphilis. The incubation period of primary syphilis is usually between 3 and 4 weeks. The first clinical manifestation of primary syphilis is a canker at the site of initial treponemal invasion of the dermis, usually on or near the genitals. Cancroid caused by Haemophilus ducrei causes multiple superficial or deep ulcers, at times mirror image ulcers with an irregular undermined erythematous margin and a granular base plus painful and suppurative inguinal lymphadenopathy that leads to a chronic draining fistula. The initial lesion of granuloma inguinale caused by Calymatobacterium granulomatis is a painless nodule that enlarges into a painful hypertrophic velvety indurated beefy red ulcer. Absence of lymphadenopathy is a diagnostic characteristic of granuloma inguinale. Urethral discharge is seen almost exclusively in men, with principal causative organisms being Neisseria gonorrhea and Chlamydia trachomatis. Most patients with Pemphigus vulgaris first present with lesions on the mucous membrane, such as the mouth and genitals, after which blisters develop. Diagnosis of Pemphigus vulgaris is by biopsy from the skin adjacent to a lesion. Histology typically shows rounded up and separated keratinocytes, acantholytic cells, just above the basal layer of the epidermis with suprabasal clefting. Phrinoderma is a distinctive form of follicular hyperkeratosis associated with vitamin A B complex as well as EFA, essential fatty acids deficiency. Keratosis pilaris is more common in individuals with underlying atopic dermatitis. Established phrinoderma tends to be more widespread with large individuals papules than in Keratosis pilaris 1 to 3 mm that coalesces into plaques. Dermatophyte species may be either ectothrix, in which spores cover the surface of the hair shaft, or endothrix, in which hyphae form anthrospores within the hair shaft. T. tonsurans causes endothrix hair invasion, often referred to as black dot, because hairs break off close to the surface. Carrion is an inflammatory pustular folliculitis child complaining of mild, painful, boggy swelling involving circumscribed scalp areas, most commonly caused by T. verrucosum. Carrion differs from favors, in which pus from hair follicles form a crust or scutula along the hair shaft. Long-standing favors caused by T. schonleni can lead to scarring and hair loss. The dermatitis in pellagra begins as an erythema. Acute pellagra resembles sunburn in its first stages, but tanning occurs more slowly than typically in sunburn. Chronic plaque psoriasis, the most common form of psoriasis, is a papillosquamous disease defined by erythematous plaques with a silvery scale. It is inappropriate to prescribe oral steroids to psoriasis patients due to the risk for steroid induced conversion to pustular psoriasis. The long term side effects of steroids and deterioration of psoriasis after withdrawal of steroids. Pustular psoriasis appears clinically as white pustules, blisters of non infectious pus consisting of WBCs, surrounded by red skin. Actinomycotic mycetoma is caused by aerobic species of actinomycetes belonging to the genera Nocardia, Streptomyces, and Actinomadura with Nocardia brasiliensis, Actinomadura maduri, Actinomadura pelletieri, and Streptomyces somaliensis benign being most common. Over 75% of mycetoma patients have a lesion of the lower extremity, most commonly in the foot, followed by hand involvement. Most mycetoma cases start as small, painless subcutaneous nodules at the site of injury, which over time softens and ulcerates to discharge a viscous, purulent, or serous anginous fluid containing the characteristic granules. Actinomycetoma is usually treatable with antibiotics, and surgery is usually not needed. Diagnosis of mycetoma can be made by the classic triad of painless soft tissue swelling, draining sinus tracts, and extrusion of grains. Genital herpes caused by HSV1 typically does not recur frequently, unlike genital herpes caused by herpes simplex virus type 2. Zang cells, acantholytic cells, are found in herpes simplex, varicella, and herpes zoster, Pemphigus vulgaris, and cytomegalovirus. Grove sign is seen in LGV, chlamydia. Herpes simplex and Haemophilus ducrei can cause painful lesions over the glans penis. Gonorrhea will never have lesions over glands, but it will present with urethritis. LGV does not present with any lesion over glands, but there will be lymphadenopathy present. The patch test, which is used for the diagnosis of contact dermatitis, relies on the principle of type 4 hypersensitivity reaction. Trichothiodystrophy is a rare multisystem autosomal recessive disorder characterized by sulfur-deficient, short, brittle hair. Trichothiodystrophy is diagnosed by demonstrating low sulfur content on biochemical analysis of hair shafts, in addition to one of the following findings: trichosis, broken or split hairs, alternating light and dark bands called tiger tail banding in the hair shaft found by polarized light microscopy or trichoscopy, a severely damaged or absent hair cuticle by scanning electron microscopy. Annular lesion is characterized by erythematous and vesicular or scaly border with central clearing. Discoid or nummular lesion presents with red, inflamed, coin or round disc-shaped patches of skin with a scaling and crusty appearance, most often on the scalp, cheeks, and ears, with same consistency of center and the periphery. Targetoid lesion is a red edematous ring that may have a central dusky disc and an erythematous halo with classic three zones: central necrotic, middle edematous, and peripheral erythematous. Dermatitis herpetiformis is characterized by neutrophils at dermal papillary tips and blistering lesions. Dapsone action against neutrophilic disorders is drug of choice for dermatitis herpetiformis. Trichotillomania has been classified as OCD in ICD-11. Freyr-Tuck sign is seen in trichotillomania. Habit reversal training is the primary mode of treatment in trichotillomania. Piebaldism is an autosomal dominant disorder characterized by dysfunction of neural crust cells and does not improve with age. Waardenburg syndrome is characterized by piebaldism, hypertelorism, heterochromia iridis, and SNHL. Nervus acromicus or nervous depigmentosus is characterized by defective melanosome transfer to keratinocytes. Examples of primary acantholysis include Pemphigus, Hailey-Hailey disease, Brewer's disease, bullous impetigo, SSSS, etc., while that of secondary acantholysis include herpes simplex and zoster. Pemphigus vulgaris occurs due to defect in desmoglein 1 or 3. Bullous pemphigoid occurs due to defect in BPAG1 or 2. Pellagra is seen more in women. This may be because tryptophan metabolism is inhibited by estrogen metabolites. The dermatophytes grow only within dead keratinized tissue, but fungal metabolites, enzymes, and antigens diffuse through the viable layers of the epidermis to cause erythema, vesicle formation, and pruritus. Dermatophytosis of the glabrous skin commonly gives rise to the annular lesion of ringworm, with a clearing scaly center surrounded by a red advancing border that may be dry or vesicular. Relapsing infections in herpes levilis are limited to the mucosa of the hard palate or in older children and adults, the lips. Thank you. If you like this video, please do watch, like, share and subscribe.